Medicare Part D is getting a major update in 2025, and if you don't know what's coming, it could cost you. I'm breaking down everything you need to know about the new changes, like that sweet $2,000 out-of-pocket cap everyone's talking about. Plus, how to avoid throwing away money on penalties that stick with you for life. Hey y'all, I'm Callie, and I'm a licensed insurance broker and certified Medicare expert. I spend my days helping people like you navigate the ins and outs of Medicare and avoid costly mistakes, and I want to do exactly the same for you. And I'll walk you through Medicare Part D, which is your prescription drug coverage if you're on original Medicare, what all it covers, and most importantly, what you need to know to steer clear of the Part D late enrollment penalty, and how to keep your medications affordable as we head into 2025. So Medicare Part D is one of the 4 parts of Medicare, and like I said earlier, it covers your prescription drugs. Now, it's not part of original Medicare, that's just parts A and B, which cover everything you do inside of the hospital and all of your doctor's visits and outpatient care. Part D is actually something you can choose to buy through the private insurance companies that are approved by Medicare. And you decide if you want a Part D plan or not when you're first eligible for Medicare at age 65, or for some people that are younger and qualify due to a disability. This plan is essential because it helps cover the cost of all of your medications you pick up at the pharmacy. Medicare Part D covers a wide range of prescription drugs, but something to keep in mind is that not all drugs are covered, and what's covered will vary by plan. Each plan has its own formulary, which is just a list of drugs that the plan covers. Formularies are organized into tiers, with drugs in high tiers usually costing you more money out of pocket. Tier 1 are your preferred generics and usually the lowest cost, and sometimes even $0. Tier 2 are your non-preferred generics. Tier 3 are preferred brand names. Tier 4 are non-preferred brands, and Tier 5 are specialty drugs and the most expensive. If you're finding this breakdown helpful so far, let me know with a thumbs up down in the comments, or feel free to ask any questions you still have after watching, and I'll be sure to answer those in my next video. Now, let's talk prior authorizations. Some Part D plans might require you to get approval before they will cover certain drugs. This is usually for more specialized or expensive medications. If you have a prescription that requires prior authorization, your doctor will have to send in a request to your insurance company explaining why you need that specific drug. If they approve it, then you're good to go. If not, you can go through an appeals process. So honestly, knowing if any of your prescriptions need prior authorization can save you a lot of headaches, and you should take a close look when you're picking your plan, especially with all of the 2025 updates. And I know y'all have seen all sorts of mail, commercials, ads, and people, and just videos in general talking about the $2,000 out-of-pocket cap, which is great news for anyone that has to pay for expensive medications, because this new update means you'll never pay more than $2,000 out of pocket in a year for covered prescriptions. So this means for 2025, you'll want to double. No, scratch that. Triple check that your meds are still covered on your plan's formulary to avoid any surprises, because you will see that not all plans have a $2,000 cap, and that's because some specialty or brand name drugs are not covered. And just like how what's covered can vary by plan, so can the costs. The cost of Part D varies depending on your plan and the insurance company you decide to go with, but you can expect to have monthly premiums anywhere from $0 a month to over $100 a month. The dreaded coverage gap, also known as the donut hole, is being completely eliminated and replaced with a 3-phase plan. First, you have to pay your deductible of $590 in 2025, and after you pay $590, you'll then pay 25% of the cost of your drugs in the initial coverage phase until your out-of-pocket spending reaches $2,000, and then you enter the catastrophic coverage phase. At that point, you won't pay anything beyond $2,000 for covered drugs. There is a program called Extra Help, and if you're low income, it helps cover the cost of Part D premiums, deductibles, and copays. Feel free to give me a call and I can help you walk through that process and see if you're eligible. And if you've found this video helpful so far, go ahead and give it a thumbs up and subscribe to our channel for more expert insurance tips. Now, you can't just go and sign up for a Part D plan anytime unless you qualify for a special enrollment period, like if you move out of the plan service area or you lose your other drug coverage, like through an employer. You can sign up for Medicare Part D when you first qualify for Medicare during your initial enrollment period, which starts 3 months before your 65th birthday, the month you turn 65, and then 3 months after. Or you can sign up during the annual enrollment period, which is every year from October 15th to December 7th. And I can't express this enough, but it's essential that you sign up at the right time. If you don't have Part D coverage for more than 63 days after you're first eligible, Medicare will hit you with a lifetime late enrollment penalty added to your Part D premium, and it goes up every month you go without prescription drug coverage. So I strongly recommend that you get Part D coverage even if you don't take prescriptions right now. And during your initial enrollment period, you'll have a couple of big decisions to make about how you're going to get your Medicare coverage. So the first, which I do not recommend, and that's to stick with original Medicare, Parts A and B coverage with a Part D prescription drug plan. And I'll tell you why I'm not a fan, because if you go into the hospital and you're admitted for just one night, you're going to pay $1,676 deductible in 2025 for just one night. And then you're also going to pay 20% of everything you do medically. And this can be an enormous number, and there's no max on how much you'll pay. So that's why I'm not a fan of that option. So a second option is once you have Parts A and B in place, you can go and get yourself a Medicare Advantage plan. You have to stay enrolled in Parts A and B to get a Medicare Advantage plan, which is also called Part C. Most of these plans have $0 premiums, and most of these plans have added benefits like prescription drug coverage, your Part D, and vision and dental at no extra cost. So these plans all have a max out of pocket, and that's what's going to save you. And I know you've seen in the news about companies dropping Medicare Advantage plans.
1,000 more Vermont seniors forced to find new health care coverage after another company offering Medicare Advantage plans pulls out.
But if this happens, you can shop for a new Medicare Advantage plan, or you can also go find yourself with a unique opportunity, and that's to go back to original Medicare, get a Part D plan, and get a Medigap plan, which is also called a Medicare Supplement plan, with no health questions. So that's the good news. So hopefully you're feeling a bit more confident on what Medicare Part D is and prepared to navigate the changes in 2025. If you found this helpful, please like this video and subscribe to our channel for more expert insurance tips on all things insurance. And if you have any questions or you still need help figuring out what works best for you, I'm always here to help. So just click the link in the description below to schedule a consultation with me. My services are always free, and we can go over all of your Medicare options. And after that, if you're ready for the next step, check out this video right here where I do a side-by-side comparison on costs and benefits of Medicare plans to help you find the best Medicare plan in 2025. As always, thanks so much for watching, and I'll see y'all next time.